Exercise and psychological well being. Physical fitness is positively associated with mental health and well being, and long term exercise is usually associated with reductions in traits such as neuroticism and anxiety. Appropriate exercise results in reductions in various stress indicators, including neuromuscular tension, resting heart rate, and stress hormones. While we predominantly deal with an athletic population, some of us will work in the industrial setting. Some of our industrial athletes may not be accustomed to traditional exercise programs. Additionally, just because an individual plays sports while they're young does not mean that they are necessarily going to be physically fit for the rest of their life. We need to educate our athletes about exercise and the physiological and psychological benefits throughout the lifespan.
So, why choose exercise for our psychological well being? Unfortunately, we cannot avoid stress. Stress is a part of our daily lives. Technology has been developed to make our lives easier. However, it has made the world exceedingly complex and increasingly pressured. Americans, in particular, are working longer hours and are exercising less and less, and our health is seeing the ill effects of being sedentary. Exercise can positively influence feelings of well being. Exercise can help reduce anxiety and depression, enhance mood, improve self concept, and improve quality of life. Additionally, exercise can result in increasing feelings of vigor. Some people have suggested that exercise is the most powerful pill that can be utilized to help increase health and well being. The President's Council on Physical Fitness and Sports has said if exercise could be packed into a pill, it would be the single most widely prescribed and beneficial medicine in the nation. Exercise is a wonderful treatment for those living with pain or chronic conditions that is hugely underexploited. Study author and a lecturer at the University of South Australia, Michelle McDonald, has stated exercise reduces blood pressure, weight, and diabetes. If exercise was a pill, you'd essentially be taking one pill to treat multiple conditions, maybe 4 or even 5 different conditions. That's how effective exercise can be. According to the Center of Disease Control, or CDC, well-being is a positive outcome that is meaningful for people from many sectors of society because it tells us that people perceive that their lives are going well. Good living conditions, such as housing and employment, are fundamental to well-being. Tracking these conditions is important for public policy. However, many indicators that measure living conditions fail to measure what people think and feel about their lives, such as the quality of their relationships, their positive emotions and resilience, the realization of their potential, or their overall satisfaction with life, which are all factors that play into general well-being. Well-being generally includes a global judgment of life satisfaction and feelings ranging from depression to joy. The feelings of well-being include self-acceptance, which is a positive view of oneself, positive relations with others, including feelings of trust, care, and empathetic relationships. Autonomy, which is a self-determined feeling characterized by intrinsic motivation and self-reference standards. Environmental mastery, which is effective mastery of the environment to fulfill personal values. Personal growth, the sense of development and self-fulfillment over time. And purpose in life, which is directed towards purposeful goals for living. Mental health issues account for approximately 30% of all hospitalizations in the United States. Anxiety and depression are the two mental health issues that have received the most attention. So far, most studies of the relationship between exercise and the reduction of anxiety and depression have been correlational in nature. This means that the relationship is based on a cause and effect, so it is difficult to conclusively state that exercise caused or produced a change in anxiety or depression states. However, exercise still appears to be associated with positive changes in mood states and reductions in anxiety and depression. Aerobic exercise has been demonstrated to work the best, but other forms of exercise are also quite effective as well. As we continue, let's talk about regular exercise. Regular exercise can make a significant impact on people's overall well-being. There is a large body of literature which supports the position that regular exercise leads to improved psychological effects. This research indicates that regular exercise reduces the negative effect and also increases the positive effect of well-being. Resistance, aerobic, and cross-training exercise modes are associated with beneficial psychological effects. Exercise for the reduction of anxiety. There have been acute effects, which are essentially short-term effects associated with exercise reducing anxiety levels. Aerobic training results in consistent reductions in somatic state anxiety. The positive benefits may not be due to just the exercise itself. Exercising at a level of at least 70% of maximum heart rate shows a greatest reduction in post-exercise state anxiety. The chronic effects, or long-term, are usually around 12 months of frequent exercise and include a reduction in the state anxiety that may last many weeks after exercise stops or ceases. The principle of more is better does not necessarily apply to exercise, however. Greater physiological gain does not necessarily result in greater psychological gain. Regular exercise is known to increase cognitive function, though. Cognitive function can be defined as cerebral activities that lead to knowledge, including all means and mechanisms of acquiring information. Cognitive functions encompass reasoning, memory, attention, and language, and lead directly to the attainment of information, and thus knowledge. Cognitive function should not be confused with IQ. They are not necessarily the same thing. There's other research in the literature, so let's look at some of the other research reports. Moderate to intense aerobic exercise is also effective in promoting well-being. Some research shows that individuals' preferred intensity may be best. If participants are not allowed to choose their own intensity, boredom or dropout was more common, thus defeating the purpose of engaging in exercise. Acute bouts of exercise are not usually immediately effective in increasing feelings of well-being. Delays of 30 to 90 minutes have been shown. The delayed anxiolytic effect is the phenomenon that beneficial reduction in anxiety does not necessarily manifest itself until sometime following an acute bout of exercise. State anxiety can reduce for up to 24 hours following exercise as well. Let's talk about the circumplex model of affect. This is not in your textbook. We have either high arousal or low arousal. Exercise can either be considered unpleasant or pleasant. If exercise has a high arousal but is unpleasant, it will result in a negative affect for the individual. If exercise has a high arousal but is pleasant, it will result in a positive affect for the individual. If exercise has a low arousal and is unpleasant, it will have a negative affect for the individual. And finally, if exercise has a low arousal but is pleasant, it will have a positive affect for the individual. Basically, this model shows that exercise, affect, or behavior is highly dependent upon the individual's perception of that exercise, whether it is pleasant or unpleasant. Exercise has also been used for the reduction of depression symptoms. Exercise is now a recognized intervention for clinically depressed individuals. All modes of exercise are effective, but exercise with greater duration provides greater antidepressant effects. The intensity of the exercise is not really related to changes in depression that we've seen in the literature. For many years, researchers have been examining the effects of exercise on well-being. Fox, in 1997, suggested that exercise is related to the participants' self-concept, self-esteem, and self-efficacy. Gruber, in 1976, yes, that really was a long time ago, suggested that positive changes in self-concept and self-esteem were associated with participation in physical education and directed play. Exercise has been studied across many populations, including children and the elderly. In children, attitudes regarding exercise are greatly influenced by parents. In the elderly, profound positive effects were noted with exercise, both physiologically and psychologically. Individuals who suffer from disabilities can benefit from exercise. Exercise has been documented to be physiologically beneficial across all disabilities. Other special populations have been examined as well. In individuals with human immunodeficiency virus, or HIV, exercise has been associated with an enhanced quality of life. In individuals with multiple sclerosis, or MS, exercise is associated with greater energy, vigor, social well-being, and sexual functioning. And in individuals with cancer, exercise has been associated with greater quality of life, or QOL. We will talk a lot more about quality of life in just a minute. Some individuals have examined the more global question on how exercise affects our quality of life, or QOL. Quality of life has been defined as an individual's perception of their position in life in the context of culture and valued systems in which they live in relation to their goals, expectations, standards, and concerns. In the workplace, quality of life is associated with feelings of life satisfaction, job satisfaction, and self-worth. Regular exercise is associated with better health, stamina, attitudes towards work, coping, total sleep time, and even quality of life, especially in collegiate populations. In our older adults, exercise is associated with greater life satisfaction, less dependence on others, and better physical health. Exercise contributes to the quality of life by influencing the affect, perceived stress, health, and satisfaction of the individual. Some people wonder how to increase their exercise frequency or how to maintain their routine. Some moderating variables include the time of the day. There is not a perfect or best time of the day to maximize the psychological benefits of exercise. Exercisers should really focus on when they are motivated and when they have the time available to exercise. Being consistent in an exercise routine is extremely important to maintaining it. Music can also have an impact on exercise. Music can increase the positive affect of the individual, and it also decreases the perceived exhaustion of the individual while exercising. We can also examine attentional strategies during exercise. One method is external disassociation or focusing. This can increase the psychological benefit of participating in exercise. External disassociation or focusing acts as a distraction. Another method is internal disassociation or focusing. This can increase anxiety for a participant, as too much focus on oneself or the work we're doing can cause people to be judgmental of themselves or to get lost in the details of the exercise. So how or why does exercise do what it does for mental health and well-being? There are physiological results from regular exercise programs. We see an increased cerebral blood flow, changes in neurotransmitters such as norepinephrine, endorphins, and serotonin levels, increased oxygen consumption and delivery of oxygen to cerebral tissues, decreased muscle tension, structural changes in the brain, increased serum concentrations of endocannabinoid receptors. Cannabinoid receptors are located throughout the body and are involved in a variety of physiological processes, including appetite, pain sensation, mood, and memory. There are also psychological changes that occur with regular exercise, including increasing feelings of control, feelings of competency and self-worth, positive social interactions, increases in self-confidence and self-esteem, and opportunities for fun and enjoyment. There are several theories that try to explain why exercise works on a psychological level. One is the cognitive behavioral theory. It encourages and generates positive thoughts and feelings and counteracts negative mood states. The social interaction hypothesis suggests that associations with friends and colleagues is pleasurable and has a net effect of improving our mental health. The distraction hypothesis suggests that exercise affords an opportunity to be distracted from worries and frustrations, whereas the cardiovascular fitness hypothesis proposes that improved mood states is associated with improved cardiovascular fitness. Other explanations have suggested that changes are more chemical in nature, like the amine hypothesis and the endorphin hypothesis. The biogenic amine hypothesis states that depression is caused by a deficiency of monoamines, particularly noradrenaline and serotonin. According to this hypothesis, depression can be alleviated by drugs that increase the availability of noradrenaline and serotonin. The endorphin hypothesis suggests that exercise promotes psychological well-being by increasing the secretion of endorphins, which reduces the sensation of pain and produces a state of euphoria. This is more or less an explanation of feeling better through chemical changes. Exercise and the special populations. When examining exercise in clinically treated patients, especially depressed populations, we see greater psychological benefits than for healthy patients. This includes participating in both aerobic and anaerobic exercises, and the results were best if the exercise regimen is a long-term commitment with participation. Some studies have shown that exercise is just as beneficial as treatment compared to some forms of psychotherapy and even drug therapy. If you are struggling due to the COVID-19 virus or having any issues with your mental well-being, please reach out to me. There are many university services that are still available to you even in the digital environment. I want you to know that people care about you and we want you to be successful. So please reach out if you are struggling.